Okay, Nikki, I'm gonna start checking your scalp. We're gonna do a few tests today to try to pinpoint what's causing that itchiness. So I'm gonna be dividing the hair, the scalp in 4 regions, 4 areas, and we're gonna examine each one of them. Is that comfortable? Okay, so first we're going to be taking a look at the hairline. Okay. Is there any pain here at all? No. Okay. So just starting on this area, I don't really notice any irritation or swelling. No pain, so that's great. And skin around the ears looks normal. Sometimes that can be affected the skin around the hair. If there's any use of harsh products on the hair, it could affect the skin as well. Okay. And I'm going to be examining this part over here. I notice a little bit of clogged pores, a couple inflamed follicles. It's actually very, very minimal. Okay, just looking here around the ear and the upper part. A little bit of scaly areas on the scalp. And this area, the scalp looks pretty healthy. No dryness or irritation. Okay, so here we start seeing some dandruff. Try to loosen it up. So the dryness is mostly accumulated or concentrated on the upper part of the first quadrant, which is usually due to stress and possibly environmental factors. I'm going to be taking a few samples of the first quadrant before we move on to the next one. I'll be preparing the skin. Okay. I'm going to be doing a couple different samples. So I'm going to start on the upper part of this quadrant where I notice most of the I'm going to apply some of this foaming agent that's going to help us gather as much information as possible. Okay. I'm going to be measuring the skin elasticity. determine any early signs of aging on your scalp, which will definitely affect the health of your follicles. Okay. So within normal parameters. Okay. I am going to be doing a few tests. Are you awake?
Mm-hmm.
Okay, I'm going to be asking you a few questions, okay?
Mm-hmm.
Okay, so now we're going to be doing a few tests. And first I want you to tell me if you feel. So I'm going to do either one or two pressure points at the same time, okay? You can just say one or two.
One. Two. One. Two. Two. One.
Okay. Is that tickling you?
Yeah.
Yeah. Okay, so now we're going to try. Can you tell me if this feels sharp?
Yes.
Yeah? Okay. This is going to be the other sensation. This is going to be dull. So I want you to tell me either sharp or dull.
Sharp. Dull.
Okay.
Dull.
Okay.
Sharp. 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 Dull. Dull. Dull.
Okay. Okay. Now can you tell me if this feels cold?
Yes.
Okay. How about now?
Yes.
No.
Yes.
No.
Yes.
Okay. Okay, I'm just going to take a few measurements here. Okay, so we've got one and a quarter inches by 3.5. No, 3.25. Two. Okay, that's 4.25. So now I'm going to be taking a look at the hairline along your face, second quadrant. Seems to be a little bit dry towards the ear. But mostly healthy. I have to take another sample of this area. So we're going to try to determine if this dryness is due to environmental reasons or some product that you've been using. Okay, so yeah, definitely the dryness is concentrated in the top portion of the first quadrant, and the bottom part of the second quadrant. So I'm leaning towards the cause being environmental and stress. So I'm gonna work on this area, trying to loosen up some of the flaky skin. Okay, before I apply the treatment, I want to make sure I measure the moisture content and elasticity on the skin. Make sure we treat the scalp properly. See a little bit of dryness located towards this area right here. Okay, we're going to be doing a similar test as we did before. Can you go ahead and tell me if you can feel 1 or 2 pressure points?
1.
About now?
2.
2. Okay.
2.
Okay.
1. 1. 2. 2.
Okay. Can you go ahead and tell me if this feels sharp or dull?
Ooh, sharp.
Does it feel sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Sharp or dull?
Sharp.
Sharp or dull?
Dull. 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 Sharp. Sharp.
Okay, so I'm gonna slide the sharp object all the way through the scalp. Let me know if there's any spot where you don't feel it or feels numb or just different. Did that feel the same?
Mm-hmm.
Okay. Okay, I'm gonna be using this tool just to stimulate the scalp before we apply the treatment. I'm gonna take a few measurements. Okay. Okay. I'm gonna be using this spray just to store it, and then we're gonna be applying a treatment. Okay. Okay, Nikki, I'm gonna be moving on to your left side, okay?
Okay.
Hi, Emily.
Hi, doctor.
So, I see here that you've been having a little bit of trouble hearing.
Yes, yeah, it's been pretty bad. I've been having to turn up the TV and my music.
Okay. So you can still hear, it's just a little bit like muffled or
Yeah.
something? Okay.
Mm-hmm.
How long has this been going on for?
Maybe the past 2 weeks, I would say.
Okay, 2 weeks. Okay, did something happen?
No, nothing happened. I've been to the beach a few times, so maybe sand got
Okay.
in there. I don't know.
Okay, we'll take a look.
Okay.
Have you noticed any other symptoms? Maybe like redness, itchy throat, watery eyes, something else?
No, just can't really hear that well and just feel a little clogged up.
Okay, for sure. We're going to be taking a look at that. Let's start with a couple hearing tests.
Okay.
Make sure that we can pinpoint. Would you say that this hearing loss is more in one ear?
I would say it's more in my right ear.
More in the right.
Mm-hmm.
Okay. So I'm going to start. You can go ahead and close your eyes. And I'm going to be doing, making a sound close to you, either one of your ears. Just let me know where you can hear it. Was that on your right, your left? Could you hear that at all?
I didn't hear anything. Oh, yes, I hear that.
Okay, is that right, left?
Right. Left. Right. Both.
Okay.
Right. Left. Left.
Okay.
Both.
Okay, can you tell me if this sounds closer or this?
The first one.
Okay, how about this or this?
The first one again.
How about this or this?
The first one.
Okay. I'm going to be doing a test with the tuning fork. Okay, I'm going to place this right here. Can you tell me if that sounds equally in both ears?
I only hear it in the left.
In the left. Okay. Can you hear this?
Yes.
Let me know when it stops.
It stopped.
Okay. You hear this?
Mm-hmm.
Okay. Can you hear this?
No.
Okay. Can you hear this?
Mm-hmm.
Okay. Can you hear this?
Mm-hmm.
Okay. Which one's louder? The first one or the second one?
The second one.
Okay. Okay, so it seems that hearing is a little bit compromised, but it's still there. I'm going to be taking a look at your left ear first. I'm going to ask you to turn your head this way. Okay. First, I'm taking a look at the external ear. Looking for something out of the ordinary. Maybe palpating around it. I notice a little bit of redness behind the ear.
Oh.
Okay. Is there any pain as I'm pressing down?
Just like the tiniest bit. It's not too bad though.
Okay. Is there any pain here?
No.
Tell me if there's any pain if I pull on it.
A little on the lobe. When you put the
Here?
lobe, yeah.
Okay. Okay, I'm just going to be taking a look inside.
Okay.
A little bit of earwax. It's not too bad, but it is partially blocking the ear canal. Okay. Definitely something that we can address today.
Okay, good.
We'll go ahead and move to the other side. Okay, so now I'm taking a look at your right ear. I don't really notice any redness around the ear. Nothing on the back either. This is hard if I press on it.
Mm-hmm.
Okay. Does it hurt here?
Yes.
Okay, how about now?
That doesn't hurt as much.
Okay. Okay, I'm gonna be taking a look inside. Just go ahead and relax. Okay. Yeah, there's definitely some earwax blocking your ear canal, which is causing some buildup of pressure, which is what's causing the pain as well.
It's causing it to what?
It's causing the pain, so the pain is due to the buildup of pressure, and then the hearing loss is due to the blockage of the ear canal. Okay. So what I'm gonna do today, I'm gonna proceed and clean your ears, and that should really help with all your symptoms. Okay?
Okay. I'm sorry I can't hear you as clear in this on this side.
Okay, we'll fix that. Okay. I'm gonna start just wiping off the external ear. Okay, I'm gonna start just cleaning the outside. Okay, this tool is going to help us remove the wax without pushing it further in. With this one, we're just scooping the wax out.
I'm starting to hear you a little bit more clear.
Okay, well, that's great news.
Yeah. Does it look like it's sand?
I don't think it's sand. It's mostly just earwax, and it could happen. Just gets accumulated in there, and then sometimes when we try to clean out with Q-tips, it could just, or we might be just pushing it in and causing that block. So, okay. Okay, now I'm gonna get a little bit deeper with some light. It's gonna help us clean anything that's left.
Oof.
A bit of tingles.
Mm-hmm.
Okay. Okay, now I'm just making sure I get rid of any loose skin cells on the outer part. Okay. So now I'm going to be cleaning the inside of the ear with this brush. Going in a little bit deeper, just making sure we get anything that's left over. Okay, if you can hear that fly, it means that the cleaning is working.
Mm-hmm. Yeah, the pressure is gone too.
Okay. I am going to be applying some foaming cleanser and the external ear, just to make sure that we disinfect the area. Okay, I'll take a look at the other side. I know it was not completely blocked,
Okay.
but I would still want to clean it to avoid any
Thank you so much.
blockage. Okay, so then I'm going to start cleaning the outer part of the ear. I'm going to make sure that as I'm cleaning, I don't bring any bacteria inside that could cause an infection. Just making sure that area is clean. Okay. Okay, we're going to start just cleaning the outer part, and then we'll be moving in. If at any point you feel any pain, please let me know. This shouldn't feel painful.
Okay.
Okay, I'm going to start cleaning inside. Same thing, we're slowly clearing the ear canal and making sure we don't push anything inside. Okay, I'm going inside the ear a little bit deeper with my light. Just making sure we get everything out. Okay, I'm just going to be cleaning anything that might have been left over with the brush. This might tickle a little bit.
Mm-hmm.
Now I'm going to be applying some foaming cleanser just in the external part of the ear. Okay, I'm going to take one more look. Make sure that we got everything. Okay, looks very clear. Shouldn't have any more problems.
Yeah, I could hear you just fine now.
That's great news.
So happy.
Just gonna go ahead and dry, making sure we don't leave any cleanser or okay, so I'm going to be redoing the hearing tests.
Okay.
Just making sure that everything is normal now.
Sure.
Okay, I'm going to be making a sound close to either one of your ears. Okay? Can you tell me if you can hear this on your left, right, or both?
Right, left, both. Right, left, both. Right, left, left, right, both, 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 both.
Okay, can you hear this closer or this one?
The first.
This is closer or this?
The first.
Is this closer or this one?
The first.
Okay. Now, can you tell me if you can hear this evenly or symmetrically in both ears?
Evenly.
Evenly, okay, perfect. One more time. Does it sound the same?
Yes.
Does it sound the same?
Mm-hmm.
Okay.
Yes.
Now, just let me know if you can hear this.
Mm-hmm.
Let me know when it stops.
Stops.
Okay. Can you hear this?
Mm-hmm.
Let me know when it stops.
Stopped.
Can you hear this on your right or your left?
My right.
Right or left?
Left.
Right or left?
Left.
Okay, Emily, it seems that the cleaning that we did worked, and seems like everything's back to normal.
Mm-hmm. Thank you.
Yeah, do you have any questions for me?
Should I put like drops in them, or are we all good now that it's all cleared out?
So if this happens again, I'm gonna give you a prescription for some drops that are gonna help you eliminate the blockage. It just helps the wax kind of like melt.
Sure.
And come out of the ear easier. I just don't recommend using Q-tips.
Okay.
They could be the culprit for the blockage. So just stay away from them. Whatever you can clean with your finger without going too much in. And if you ever need it, I can give you these drops that are gonna help you. Maybe it's a good idea to use them once a month.
Okay, perfect.
Okay.
Thank you.
Okay, very good. Okay, Caitlin, so today we're gonna be doing very classic hairstyle. I'm gonna tell you what I have in mind and just let me know if that sounds okay to you.
Okay, perfect.
So we're gonna go with a very classic ballerina bun. Very sleek. We're gonna leave your bangs down, so they're gonna be framing your face, but the rest is just gonna be up here in a bun.
Okay.
How does that sound?
Perfect.
Good? Okay. So I'm just gonna start brushing the hair. I know buns seem like they're an easy hairstyle, but since we're gonna try to get it super sleek, very stylish, and just we're gonna have to be patient, okay?
Sounds good.
Are you comfortable? Can I offer you any water or anything?
I'm very comfortable. Thank you so much.
Okay. Gonna start just making sure I separate your bangs. Okay. So just gonna make sure that I'm gonna leave this little longer framing pieces out. The rest we're all gonna be putting back. There's so tiny. Just trying to make sure. Leave the small hairs where they belong. So they don't. Okay. That's beautiful. This back right there for now. I'm gonna actually be turning you like that. So I'm gonna be putting up the bags on a roller just to keep the shape of them. Actually, I think I see what that does belong. A little longer, so we're moving that to the side. Do you mind if I straighten a little hair that's... Go for it. that's gonna stay there while we work on the bun. Just gonna turn you. Okay. So I'm gonna start just brushing and trying to gather all the hair. So there's a lot of flyaways. So I'm actually gonna have to use a styling cream. It's gonna help us get that sleek look. So this is the most important step, and this is why we gotta be super patient right here. If we don't get this first step as smooth and sleek as possible, it's gonna make everything a lot harder. Okay, now we're gonna attempt to tie this up. It is normal to still have some flyaways, so we'll be taking care of those in a second. Just making sure. So now I am going to apply a little bit of wax and take care of the flyaways before we move on. Next step. Start with a tiny bit of hairspray. Using this small brush. And we're brushing any imperfections to the top, which we will cover up. I'm going to smooth that out in a second so it doesn't look waxy. So I'm actually going to retie this now that we have the hair very smooth. Yeah, I love how it's turning out. So we'll do this one more time. So we're going to be using a different hair tie to make sure it ends up as tight as possible. Okay. How does that feel? Is that pulling at all?
No, it's perfect.
Okay. So that looks so beautiful. Now we're gonna be using the sock method today. So I'm gonna be just to give it a tiny bit more volume. Be using this one. Here. Okay, so now I'm gonna start rolling this around the bun. So we're gonna be twisting. Making sure we smooth out. Okay. We'll be applying a few bobby pins. Make sure that stays. Okay. sort of finish off the bangs. Making sure that these tiny little hairs stay in place. Okay. Let me give you a mirror so you can take a look. Just let me fix this little hair right here.
I love it. It looks so sleek.
Yeah, I love how it looks with your bangs. It's very pretty, and then you have the framing around your face.
Thank you
It
so
looks
much.
so good in you.
Thank you so much.
Yeah.
I think it looks amazing. I'm excited to go about my day now.
Okay, well, thank you.
Thank you so much. I will definitely be back again soon.
Awesome. I look forward to seeing you. Bye.
Thank you. Bye-bye.
I'm gonna be doing your scalp check and skin check facial treatment today. Okay.
Absolutely.
You can just go ahead and relax. I'm gonna start examining your scalp. Start just taking a look at your hairline. Just using my light first. A tiny bit of irritation, some redness. take a look with my magnifying glass and the little irritation spot you have right here. Okay. It does look like some sunburned area. Do you always wear sunscreen?
No.
Okay. Okay, I'm gonna ask you to turn your head that way, just a little bit. Oh, maybe a tiny bit less. Yep. Okay. Just taking a look at the hairline, your neck. Your scalp looks really healthy. The natural texture of your hair is pretty thin, but it still looks healthy and strong. There's really no dryness or scaly areas. Just gonna take a look at the scalp a little bit closer. I do recommend that you start using some SPF on your scalp as well.
Okay.
The face, of course, is very important, but the scalp gets exposed to the sun just as much. Okay, I'm gonna ask you to turn to your right now. You can look at the other side. First, I'm just taking a look at the hairline, since this area gets very exposed to the sun. Okay, so examining the hairline as it goes behind your ear and down your neck. Everything looks good. Your hair follicles look pretty healthy. Okay, I'm gonna start taking a look at the rest of the scalp. Do you wash your hair every day? No. Yeah, I can definitely tell that your scalp is very healthy and it's not dry, which tends to happen when we strip the oils from the scalp too often and too harshly. gonna be doing a hair treatment
Okay.
on your hair. It all looks very healthy, but I'm just gonna try to strengthen your hair and give it a little bit more volume. Okay?
Absolutely.
Okay, I'm just gonna start brushing the hair. Make sure we get rid of any knots. And tiny knot. It's giving me a hard time. Just going to be placing a few drops. So this treatment is based on rosemary oil, which is going to help strengthen and just gonna help your hair grow a little more abundantly. Turn your hand a little bit this way. Making sure that I distribute that. Okay. I'm going to be using this comb just to brush the hair from the roots to the ends. Make sure we distribute the product to the ends, which is going to help with healing some of those split ends. Okay, move on to the other half. Okay, just bring your hand like that for me. Okay, I'm just gonna just massage that with my fingers. Okay, I'm gonna be using a comb just to distribute that to the ends as well. It might end up a little bit oily after the treatment, so you just gotta let it act for approximately 24 hours, and then you can wash it normal as you would. Okay, so we're gonna let that treatment act on your scalp. I'm gonna be moving on to your face. Do you have any concerns on your skin, especially your face?
Yeah, dryness and acne are my two biggest concerns.
Would you say you have more of dry skin, oily combination? What have you noticed?
More dry to oily, or dry to normal.
Okay.
Yeah.
Okay, I'm gonna first be just taking a look. Okay, so definitely some breakouts. On its lower cheek. To turn your face towards me. Okay. So these areas where your breakouts are mostly concentrated could be due to hormonal imbalances. Yeah, other than that, the skin on your forehead looks very healthy. Would you say you mostly struggle with acne in this part over here?
Yeah.
Okay. Okay, we're going to be applying a facial treatment today.
Okay.
First, I'm going to start by cleansing your skin with just a cleansing balm, okay?
Absolutely.
I'll be applying some to the skin and then massaging it so it can start acting. So this cleansing balm is pretty mild on the skin. It's not too harsh. It doesn't strip the skin of natural oils, which would be important if you have dry skin. Just gonna massage that. It's gonna help us remove any dirt, toxins, any pollutants that end up on our skin from just the environment. It should feel pretty soft. follow up the cleansing balm with another cleanser. Okay. So I usually like to double cleanse.
Yeah.
Okay, we're going to be using this foaming cleanser for sensitive skin. First, I'm just applying it to the skin. Then we'll rub it in and wipe off the excess. Okay. Okay, I'm just gonna wipe out the excess. This is a leave-in cleanser, so I want to completely wipe it off. We don't need to rinse it. Just making sure we don't leave too much of the skin. I'm just going very gently on your chin and around your mouth where most of the breakouts are located. Okay, now I want to, before I mix in your face mask and treatment, I want to test the moisture on your skin. Okay. This is just going to give me a good idea of what formula would work best for your skin. Okay. Just going to test a few different spots. Okay, so definitely towards this area of your face, it starts getting a little bit more on the dry side. Okay, and the forehead's a little bit on the dry side as well. Okay, I'm gonna be doing this hydrating treatment. Just gonna be adding a little bit of vitamin C serum. Be mixing that. Okay, I'm gonna let that sit for a second. I'm just gonna be applying this serum before we go in with the face mask. Just gonna apply a few drops. Like kind of like a thicker serum, almost like a gel. Very gently, I'm massaging it. Okay. Now I'm going to be applying the hydrating treatment. Making sure we get the forehead, the nose. Turn your face towards the light. Okay, come confront. There we go. I'm just going to be massaging that, applying a circular motion. Be dragging the treatment down to your neck as well. Your neck is really not very dry, but make sure we treat the skin anyway. Okay, I'm just going to do a gentle massage with an acupressure roller. Going to be rolling away from the face. Okay, Casey, that's it for today's treatment. Do you have any questions?
I don't think so.
Okay, thank you.